Think about tonight when you climb into bed. You'll settle onto your left side, or maybe your right, or perhaps you'll lie on your back without giving it a second thought. It's such an automatic choice that most of us never question it. But while you sleep, something remarkable happens. Your organs shift position. Blood flow changes direction. Your digestive system either works with gravity or struggles against it. And here's what almost nobody talks about. The side you choose might influence how hard your heart works, how well your stomach processes the evening meal, even how efficiently your brain clears waste during those crucial nighttime hours. I'm Dr. Naira Stein, and I've spent the past 30 years helping older adults understand how their bodies work. Today, I want to walk you through something most doctors never mention in routine checkups, how the simple act of choosing which side to sleep on might affect your comfort, your digestion, and your overall well-being. I want to be clear from the start, we're not talking about cures or miracle treatments. We're talking about understanding what happens inside your body when you shift from one side to the other. And what you learn here might help explain things you've experienced for years without knowing why. Stay with me, because by the end, you'll have information that could help you make more thoughtful choices about something you do every single night. Let me tell you about someone I worked with a few years ago. For 5 years, she'd been dealing with heartburn that came and went without any clear pattern. She tried different foods, ate dinner earlier, even raised the head of her bed. Nothing made a consistent difference. What she didn't realize was that every night she slept primarily on her right side, simply because it felt more comfortable. Meanwhile, her stomach's anatomy was working against her in ways she'd never considered. Or think about someone who wakes up with a slightly elevated heart rate more nights than not, who feels mild pressure in their chest during sleep. They mention it to their doctor, tests come back normal, and everyone moves on. But no one ever asks which side they sleep on, or whether that simple variable might be part of the picture. This is what I call the gap between what's happening in your body and what you're aware of. Sleep position sits right in the middle of that gap, and here's why it matters more than you might think, especially as we get older. You spend roughly a third of your life lying down. 8 hours every day when your body operates under completely different physical rules than when you're upright. Gravity pulls on your organs differently. Blood flow patterns shift. The system that clears waste from your brain works most efficiently during these hours, and all of these processes can be influenced by something as straightforward as whether your left shoulder or right shoulder presses into the mattress. Now, the consequences of not understanding this aren't dramatic. You won't have a medical emergency because you slept on what might be the less optimal side for your body. But over months and years, you might unknowingly make certain processes work harder than necessary. You might experience discomfort that has a surprisingly simple explanation. And most importantly, you might miss an opportunity to work with your body's natural design instead of against it. And here's what's encouraging. You don't need expensive equipment, supplements, or complicated routines. You just need to understand the basic mechanics of what's happening inside your body during sleep, so you can make one small adjustment that might make those 8 hours work better for you. Let me walk you through the anatomy, because once you understand the layout, everything else makes sense. Your stomach isn't centered in your body. It sits on the left side of your abdomen, with the entrance from your esophagus on the right side of the stomach and the exit to your small intestine on the left. This isn't random. This is your body's design. When you lie on your left side, gravity helps keep stomach contents in the main body of the stomach and encourages movement toward the exit into your intestines. The entrance from your esophagus sits physically higher, which means stomach acid has to work against gravity to move upward. Research published in gastroenterology journals has found that left side sleeping may reduce acid reflux episodes compared to right side sleeping in many people. The positioning takes advantage of the stomach's natural shape and gravity's influence. Now flip that around. When you lie on your right side, the stomach's entrance sits lower than the main body. Gravity can encourage stomach contents, including acid, to pool near that entrance. For people with a weakened valve between the stomach and esophagus, this positioning might make it easier for acid to move upward. Studies have shown that right-side sleeping was associated with increased acid exposure in the esophagus for patients with reflux symptoms. Again, individual responses vary, but the anatomical principle is consistent. Let's talk about your heart next, because this is where the mechanics become particularly interesting. Your heart sits slightly left of center in your chest, and it's not fixed rigidly in place. It's suspended in a fluid-filled sac that allows some movement. When you lie on your left side, your heart is literally closer to the mattress. Some early research suggested this might slightly increase workload for certain individuals, though more recent studies have shown mixed results. What we know more definitively is that body position affects how blood returns to the heart through your veins. Some research suggests that left side sleeping might be beneficial for people with heart failure by potentially reducing certain stresses on the heart, though this remains an area where scientists are still learning. For healthy individuals, the differences between left and right side sleeping appear minimal in most cases. However, people with certain heart conditions might notice their symptoms vary with position, which is why talking with your doctor about this matters. There's also your brain's waste clearance system to consider. During sleep, your brain has what researchers call a cleaning crew, a system that flushes out cellular waste that accumulates during waking hours. Studies have explored how sleep position might influence this process. Some research in animals has suggested that side sleeping, whether left or right, might facilitate this waste clearance more efficiently than back sleeping, though human research is still developing. The theory is that side sleeping helps maintain optimal space in the brain for fluid movement and waste removal. Now, most people think about sleep position and digestion only in terms of heartburn, but the relationship goes deeper. Your entire digestive tract has a directional flow, and that flow can be either supported or complicated by how you position your body during the night. Imagine you eat dinner around 6 or 7 in the evening and go to bed around 10. By bedtime, food has moved from your stomach into your small intestine, where most nutrient absorption happens. The small intestine isn't a straight tube. It loops and curves through your abdomen in a very specific pattern. The natural flow moves from left to right initially. When you sleep on your left side, you may be working with this natural layout. Some researchers believe left side sleeping might support the progression of intestinal contents through the valve that connects your small intestine to your colon, which sits on the right side of your abdomen. From there, the colon rises on your right side, crosses horizontally, and descends on your left before reaching the final sections. Your body has this entire transit system operating while you sleep, and position might influence how smoothly that transit occurs. Research in this area is still developing, but many digestive specialists are aware of these anatomical considerations and sometimes discuss sleep position with patients experiencing nighttime symptoms, particularly those with reflux or delayed stomach emptying. There's another factor worth mentioning, especially for older adults. Many of us take medications that affect the digestive system. Some slow stomach emptying. Some affect the valve between stomach and esophagus. Some change how the gut moves. If you're taking several medications, which is common as we age, how your body is positioned during the hours those medications are working becomes more relevant. This doesn't mean sleep position will eliminate medication side effects, but it might be one variable worth considering in a broader conversation with your healthcare provider about managing symptoms. Let's go deeper into the cardiovascular aspect, because this is where individual differences become really important. Your circulatory system operates under pressure. Blood moves from higher pressure areas to lower pressure areas, and your heart maintains those pressure differences. When you change position, you change how gravity affects that entire system. Think about blood return from your lower body. When you're standing, your heart works against gravity to pull blood up from your legs. When you're lying down, that gravitational challenge disappears and blood return becomes easier. But when you lie on your left side specifically, some researchers theorize this might affect the large veins that return blood to your heart, particularly the one that runs along the right side of your spine. Studies have noted that positional changes can affect heart rate patterns, blood pressure during sleep, and even the occurrence of certain irregular heartbeats in susceptible people. For most healthy individuals, these changes are well within normal ranges. But for someone with heart failure, coronary disease, or certain rhythm problems, sleep position might contribute to how symptoms vary from night to night. There's also sleep apnea to consider, which affects many older adults. Research has consistently shown that back sleeping is often associated with more frequent and severe breathing pauses compared to side sleeping. This happens because when you're on your back, gravity pulls the tongue and soft throat tissues backward, which can narrow or block the airway. Studies have shown that encouraging side sleeping can reduce apnea severity in many patients. But here's where it gets more specific. Some research has suggested potential differences between left and right side sleeping for people with both sleep apnea and heart conditions. One study found that left side positioning was sometimes associated with fewer breathing pauses compared to right side positioning in certain patients. However, this remains an area where more research is needed, and individual responses vary considerably. Here's what you need to understand. If you have diagnosed cardiovascular conditions, you should absolutely discuss sleep position with your cardiologist. Some heart patients are specifically advised to avoid sleeping on their left side. Others might be encouraged toward it for different reasons related to their specific condition. This is not one-size-fits-all advice. What I'm giving you is the framework for understanding why position might matter, so you can have an informed conversation with your own healthcare team. Before we talk about practical application, we need to address real-world complications that make sleep position more than just a simple choice. First, there's comfort. Some people simply cannot sleep on their left side. Maybe it's shoulder pain, hip discomfort, or just a lifelong preference. And that's completely valid. The goal is never to force yourself into a position that prevents you from sleeping well. Poor sleep quality causes far more problems than sleeping on a less than optimal side. If you have arthritis in one hip, sleeping on that side might be genuinely painful. If you have shoulder problems, you might need to favor the opposite side, regardless of what might theoretically be better for digestion. If you've had surgery, your surgeon might have given specific instructions. These factors take precedence. Your body's immediate comfort comes first. For pregnant women, left side sleeping becomes particularly important in later pregnancy. Research suggests it may reduce pressure on major blood vessels and optimize blood flow to the baby. Medical guidance for pregnancy includes sleep position recommendations, though the emphasis is on side sleeping in general rather than being rigidly fixed on one side all night. Snoring is another practical factor. Many people find that back sleeping increases snoring, while side sleeping reduces it. If you share a bed, your sleep position might be influenced by considerations beyond your own body. Sometimes the best position is the one that allows both people to actually rest, even if it's not theoretically optimal from a purely individual standpoint. There's also the simple reality that most people don't stay in one position all night. Sleep studies have shown people typically shift positions multiple times, often without remembering. You might start on your left side and wake up on your right or your back. This is normal. The question isn't about maintaining a rigid position for 8 hours. The question is which position you're in for the majority of the time, particularly during deeper sleep when your body is doing the most restorative work. So here's a question worth asking. If sleep position can influence digestion, heart function, and brain waste clearance, why isn't this part of standard health advice? Why don't doctors routinely ask about it during checkups? The answer reveals something important. First, the research exists, but it's scattered across different specialties. Digestive specialists might know about the reflux research. Cardiologists might know about the heart studies. Sleep specialists understand the apnea connection, but this information doesn't always get synthesized into simple guidance that crosses specialty boundaries. Second, the effects are generally subtle for healthy individuals. They're not dramatic or immediate. You won't feel radically different after one night on your left side instead of your right. The potential benefits, if they exist for you, would accumulate gradually. That makes them harder to study rigorously and harder to motivate people to pay attention to. Third, there's the challenge of individual experimentation. Unlike taking medication where you can clearly see effects, sleep quality has so many variables that it's difficult to isolate position alone. Was last night better because you slept on your left side, or because you ate dinner earlier, or were less stressed, or the room was cooler? But here's what I want you to understand. The absence of widespread guidance doesn't mean this information isn't valuable. It means you have an opportunity to observe your own body's responses in a way most people never think to do. Let me bring this together for you. You now understand something most people don't. that your stomach's anatomy creates a directional preference that might influence reflux. You know that your heart's position might be affected by which side bears your weight. You've learned that side sleeping in general might support brain waste clearance and reduce sleep apnea compared to back sleeping. More importantly, you understand why this information exists in research, but rarely makes it into everyday conversation. It's not because it's unimportant, it's because effects are individual, research spans multiple specialties, and practical application requires personal observation rather than universal prescription. Here's what you can do starting tonight. First, pay attention to your baseline for the next week. Simply notice which position you naturally gravitate toward during sleep. You might already be doing what works best for your body. If you consistently wake up on one side, that's valuable information. If you experience reflux, note whether it happens more on nights when you sleep on your right side versus your left. If you have heart-related symptoms during sleep, observe whether position correlates with how you feel. Second, if you want to experiment with left side sleeping, make it comfortable. Use a pillow between your knees to maintain hip alignment. Make sure your shoulder isn't compressed in a way that causes pain. Consider a body pillow that helps maintain the position without effort. The goal is sustainability, not forcing yourself into discomfort. Remember, sleep quality matters more than sleeping in a theoretically optimal position that prevents actual rest. Third, track your observations. Keep a simple sleep journal for 2 weeks. Note your position, how you feel in the morning, whether you experienced reflux or heart symptoms, and your overall sleep quality. Look for patterns. This isn't about perfection. It's about gathering information on your own body so you can make informed adjustments. You might discover position makes a noticeable difference, or you might find other factors matter more. Either finding is valuable. Fourth, and this is critical, discuss this with your healthcare provider if you have any diagnosed medical conditions, particularly heart disease, significant reflux, sleep apnea, or if you're taking multiple medications that affect these systems. Your doctor might have specific guidance based on your history. This information doesn't replace medical care. It enhances it by giving you and your doctor more variables to consider. Here's what makes you different now. After learning this, you understand that your body operates according to physical principles that don't stop when you're asleep. You recognize that positioning matters. You know there's often a gap between what's happening in your body and what you're consciously aware of, and that you can bridge that gap through informed observation. That awareness gives you the ability to make adjustments most people never consider, not because others aren't thoughtful, but because nobody ever explained the underlying principles to them. You're more informed now. You understand that your body follows predictable physical principles even during sleep, and you're equipped to investigate what works specifically for you. That's genuine empowerment, not promises of miracle solutions, but understanding of how your body actually functions so you can work with it thoughtfully. Your body is wiser than you might realize. It often knows what it needs. Sometimes we just need to pay closer attention and give it the conditions to do its best work. Sleep well tonight, and know that you're taking care of yourself in ways that matter. That's something to feel good about.